Hi, Dr. Nelson here from CounselingTransforms.com, where we help our clients achieve their best self, better relationships, and a more balanced life. Today's topic is EMDR. EMDR stands for Eye Movement Desensitization Reprocessing and is an evidence-based practice for things like PTSD, post-traumatic stress disorder, but also other issues like addiction, strong emotional regulation, all kinds of different things. The cool thing about EMDR is when we have issues in our life that have been, say, traumatic or painful, the neurons in our brain fire around those things, and neurons that fire together wire together. And then what happens is those things become entrenched in usually the right side of our brain. I've talked in other videos about an amygdala-based fear response. Well, when we get triggered, the amygdala pulls things usually from the right side of the brain, so that's going to be images, sensations, emotional memories, and can pull those into the present as if they're happening now without our conscious awareness. And so it really feels like these things are happening now. And that explains why sometimes we know one thing, but then on the other hand, our emotions tell us something else. But the difference between what we know to be true and what our emotions are telling us kind of clash. So what EMDR does is it mimics REM sleep. So when we go into REM sleep, our eyes go back and forth, back and forth, back and forth, and our brain can move things around, prune, file, change things up. And what EMDR does is uses what we call bilaterals to do the same thing, to make our brain go left brain, right brain, left brain, right brain, so that our brain can naturally heal itself and move things around more easily. What EMDR can do, for example, is help our brain to move things that are stuck in the right side of our brain by changing the way the neurons fire more towards the left side of our brain, which is going to be the cognitive rational part of our brain, so that they can make peace with one another and we can take the emotional reactivity or the emotional intensity out of things. Things that have been entrenched in our minds over a long period of time, like let's say anxiety, fear, worry, guilt, things like that, where our neurons have fired around those for maybe years, those become kind of like superhighways in our brain. So like think massive superhighway like the Autobahn in Germany, where cars are just flying down the road. So when those superhighways in our brain get triggered, they're fast, they're automatic, almost like ruts in our brain that determine a lot of different things that we think, that we experience, and even that we do. What EMDR does by allowing our brain to change the way the neurons fire is kind of like drops construction zones into that negative superhighway, the anxiety, fear, guilt superhighway, to slow the traffic down. Similarly, most of us who have difficulties in life and have had the neurons fire to make those negative superhighways, on the more positive side, usually we're kind of anemic, and so it's almost like a deer trail through the woods compared to the negative side. There's like the Autobahn or the superhighway. So another thing that EMDR can do by going left brain, right brain is allow us to target certain areas to build up the more positive neural connections, or the neural connections around things that are more positive. Things that are calming and peaceful and give us sense of security and hope and things like that. And so it takes that metaphoric deer trail and starts to beef it up into hopefully like an ATV trail, then maybe a paved road, something like that, until we beef up the more positive things in our mind to help offset the more negative things that we're entrenched in. EMDR tends to be effective and useful for most clients, and it gets results quickly compared to many other forms of treatment. When you're considering an EMDR therapist, make sure that they are properly trained. And so one of the things that you can look for is EMDRIA, which is EMDRIA, the International Credentialing Organization for EMDR Therapists. And so your therapist should be EMDRIA trained. All of our EMDR therapists at Transformations Counseling have been trained through EMDRIA approved training programs, and that's important to understand when you're looking for an EMDR therapist, because EMDRIA is the International Credentialing Organization for EMDR. And so you want to make sure that your EMDR therapist is properly trained, and the EMDRIA approved trainings are the way to give you that assurance.